Chapter 27, Patient Safety and Quality. Patient-centered care promotes safety and requires the nurse to recognize that patients or their designee as the source and full partner in providing compassionate and coordinated care based on respect for the patient's preferences, values, and needs. The Agency for Healthcare Research and Quality describes key factors of a culture of safety. There should be an acknowledgement of the high-risk nature of an organization's activities and the determination to achieve consistently safe operations. There should be a blame-free environment where individuals are able to report errors or near misses without fear of repercussion, reprimand, or punishment. There should be encouragement of collaboration across levels of employees and disciplines to seek solutions to patient safety problems. And there should be an organizational commitment of resources to address any safety concerns. A patient's environment includes physical and psychological factors that influence or affect the life and the survival of the patient. The broad definition of environment crosses the continuum of care for settings in which the nurse and patient interact, like the hospital, long-term care facilities, clinics, communities, centers, schools, and homes. Physiologic needs, including the need for sufficient oxygen, nutrition, optimum temperature, all influence a person's safety. According to Maslow's hierarchy of needs, these basic needs must be met before physical and psychological safety and security needs can be addressed. Physical hazards in the home and work environment can threaten a patient's or person's safety and result in physical or psychological injury or death. In 2016, unintentional injuries became the third leading cause of death in the United States. Motor vehicle accidents, poisonings, and falls were the leading causes of unintentional injuries. Additional environmental hazards included fires and disasters. Natural disasters, considering floods, tsunamis, hurricanes, tornadoes, or wildfires, are a major cause of death and injury. These types of disasters may result in death and leave many people homeless. Every year, millions of Americans are affected by natural disasters and their terrifying consequences. Bioterrorism is yet another cause of disaster and refers to biologic agents that are used as weapons to further someone's personal gain or political agenda. What are some safety concerns that you would anticipate for the patient? While caring for a child, you identify that additional safety teaching is necessary when a young and experienced mother states that teenagers need to practice safe sex, a 3-year-old can safely sit in the front seat of the car, children need to wear safety helmets when bike riding, children need to learn to swim even if they do not have a pool. The answer is B. Children ages 3 and younger should be in a child safety seat in the back seat of the car. A patient's developmental stage can create threats to safety because of lifestyle, cognitive and mobility status, sensory impairments, and safety awareness. Unfortunately, all age groups are subject to physical and mental abuse. Child abuse, domestic abuse, violence, and elder abuse are all serious threats to an individual's safety. Injuries are the leading cause of death in children over age 1. The nature of the injuries sustained is closely related to normal growth and development. An example would be Because of improved motor skills, coordination, and balance, preschoolers are less prone to fall than toddlers. School-age children enter a period of less intense emotions, secure in their dependency on parents and family, and with self-confidence tempered by a more realistic perspective. They have energy to explore the environment beyond the home and to gradually increase the scope of interpersonal interaction. As children enter adolescence, they develop greater independence and a sense of identity. Adolescents begin to separate emotionally from their family, and peer groups begin to have a stronger influence. Adolescents typically have wide variations that swing from childlike to mature behavior. They test boundaries by trying risky behaviors. The threats to an adult's safety are frequently related to lifestyle habits. The physiological changes associated with aging, the effects of multiple medications, psychological and cognitive factors, and the effects of acute or chronic disease increase in older adults' risk for falls and other types of accidents. Falls are the major cause of injury, leading to disability and death among adults 65 years and older. Lifestyle choices increase safety risks. People who drive or operate machinery while under the influences of any chemical substance, who work at dangerous jobs, or are risk takers are at greater risk of injury. Additionally, people experiencing stress, anxiety, fatigue, or alcohol, drug withdrawal, or those taking prescribed medications can often be more accident prone. Impaired mobility has many kinds of safety risks. Muscle weakness, paralysis, abnormal gait, and poor coordination or balance are the major factors in placing patients at risk for falls. Cognitive impairments associated with delirium, dementia, and depression will alter concentration and attention span and cause impaired memory and orientation stages. Individuals with these alterations become easily confused about their surroundings and are more likely to have falls and burns. People with lower incomes, including the homeless, are more likely to have behavioral health issues like depression or substance abuse problems that place them at risk for injury. They also do not have access to healthcare resources like medications and treatment that those with higher incomes have. Some patients are unaware of or inexperienced in following safety precautions in the home. For example, keeping medicine and poisons away from children or reading the expiration dates on food products. The nurse cannot assume a patient's knowledge about a safety topic. What environmental hazards should be addressed? The prevention of medical errors continues to be one of the most challenging healthcare events in the nation. Medical errors occur when planned actions are not completed as intended or wrong plans of care are used. Medical errors occur in all healthcare facilities. The National Quality Forum for Serious Reportable Events in Healthcare recognize these events that need to be reported. Surgical or invasive procedure events, whether on the wrong site, the wrong patient, or the wrong procedure. Product or device events, if a patient dies using any contaminated device, if it caused serious death or injury, if it begins and starts an air embolism. Patient protection events, discharge or release of patients that's unable to make any decision, a patient death, patient suicide, self-harm. There are care management events that have to do with patient death or serious injury, patient death or serious injury associated with unsafe blood products, maternal death or injury related with labor or delivery. For risks in the health care agency, refer to box 27.5 in your course textbook. Critical thinking by the nurse requires an assessment that is thorough, and the nurse will use knowledge and judgment and synthesize the information. This thinking allows the nurse to anticipate needs of the provider or of the patient. And critical thinking is an ongoing thought process for the nurse. This is the critical thinking model for safety assessment. The nurse needs to assess the patient's perception of their safety needs and the risks, identify actual and potential threats to the patient's safety, determine the impact of underlying illnesses, identify the presence of risks for the developmental stage and environment, and determine medication history and side effects that may be safety risks. A nursing history includes data about a patient's medical history and fall risk factors to determine whether any underlying conditions pose threats to safety. A physical examination focuses on bodily functions that can affect a patient's mobility and ability to interact safely in their environment. Assessing a patient's risk factors for falling is essential to determine specific needs and develop targeted intervention to prevent falls. The nurse needs to be alert of factors in the work environment that create conditions where medical errors are likely to occur. Any distraction during medication preparation or nursing procedure in the form of a phone call, alarm, or staff needing assistance are common distractions. The nurse will gather data from the nursing assessment and analyze clusters of assessment findings. These will include risk factors to identify the nursing diagnoses. In addition to accurate clustering of assessment data, an important part of formulating the diagnoses is to identify the causative or relative factors or risk factors. Consider risk for injury related to altered mobility and decreased visual acuity. Patients with actual or potential risks to safety require a nursing care plan with interventions that prevent and minimize threats to their safety. The nurse should design interventions to help the patient feel safe to move about and interact freely within the environment. The plan of care will address all aspects of the patient needs and use resources from the healthcare team and the community whenever appropriate. The patient that actively participates in reducing safety threats becomes more alert to potential hazards and is more likely to adhere to the plan of action. The nurse should ensure that goals and outcomes for each nursing diagnosis are measurable and realistic in consideration of the resources that are available to the patient. The nurse needs to prioritize the patient's diagnoses and interventions to provide safe and efficient care. This is the critical thinking model for safety planning. Remember that the patient is part of the plan process. It needs to be with something that's important to the patient and something that the patient can work on. So ensure that you as the nurse are including your patient as part of the healthcare team. The Quality for Safety and Education in Nursing outlines recommended skills to ensure nurse competency and patient safety. Among these are skills involving safe nursing practice during direct care. The nurse needs to demonstrate effective use of technology and standard practices that support safety and quality. The nurse needs to demonstrate effective use of strategies to reduce the risk of harm to self or others. The nurse needs to utilize appropriate strategies to reduce reliance on memory. The nurse needs to communicate observations or concerns related to hazards and errors to patients and families, as well as the healthcare team. This is the American Geriatric Society Clinical Practice Fall Prevention Algorithm. The way to read an algorithm is begin up in the left-hand corner with number 1. Following each of the boxes, when you come to a box that is split, if the answer is yes, you will follow that arrow. If the answer is no, you will continue in the pattern that you have already began. Nursing interventions directed at eliminating environmental threats include those associated with a person's basic needs and general preventive measures. The nurse should instruct the patient to memorize the mnemonic PASS. PASS is for use of a fire extinguisher. It is P for pull the pin to unlock the handle, A for aim low at the base of the fire, S for squeeze the handle, S for sweep from side to side. Within hospital and long-term care settings, the nurse takes various measures to maintain patient safety, including fall prevention strategies, prevention of injuries from the use of restraints and side rails, and precautions to prevent fires and exposure to poisoning and electrical hazard. Patient falls continue to be a top adverse event in a hospital. These often result in injury and even death. Falls are also a serious concern in skilled nursing and long-term care facilities. Fall reduction programs are a part of any hospital and long-term care setting routine. Patients who are confused or agitated, or those who repeatedly try to remove medical devices, may temporarily require physical restraints to keep them safe. In the nursing home environment, research has shown that restraints being used when there are increases in the degree of care dependency, as well as mobility limitations. When used correctly, side rails will help to increase a patient's mobility and stability when repositioning or moving in bed or moving from bed to chair. Although side rails are the most commonly used physical restraint, they increase the risk of falls when patients attempt to get out of bed or crawl over a rail. Side rails can also lead to patients becoming caught, trapped, entangled, or strangled, especially individuals that are frail, elderly, or confused. If a fire occurs in a healthcare facility, the protection of patients from immediate injury is first. The fire should be reported. It should be contained and extinguished if possible. Some agencies have fire doors that are held open by magnets and close automatically when a fire alarm sounds. It is vital to keep equipment from blocking these doors. All personnel evacuate patients when appropriate, and patients who are close to a fire, regardless of its size, are at risk of injury and need to be moved to another area. A newly admitted patient was found wandering the hallways for the past 2 nights. The most appropriate nursing intervention to prevent a fall for this patient would include: raise all 4 side rails when darkness falls, use an electronic bed monitoring device, place the patient in a room close to the nurse's station, use a loose-fitting vest-type jacket restraint. The answer is B. For wandering patients, an electronic monitoring device can be used to notify the nurse when the patient is mobile. The patient should be encouraged to take specific length walks, such as 20 minutes in the neighborhood 3 to 4 times each week, because the maintenance of physical activity lifestyles delay changes associated with cardiovascular, respiratory, and musculoskeletal function. Patient-centered care involves a thorough evaluation of a patient's perspective related to safety and whether their expectations have been met. Evaluation involves monitoring the actual care delivered by the health team based on the expected outcomes. For each nursing diagnosis, measure whether the outcomes of care have been met. This is the critical thinking model for the evaluation of patient safety. Ensuring patient safety is an essential role of the nurse. To ensure patient safety, the nurse needs to clearly communicate with all members of the team, assess and incorporate the patient's priorities of care and preferences, and use the best evidence when making decisions about interventions to use in the delivery of patient care. When observing the home environment, throw rugs need to be removed or replaced with rubber-backed rugs. Lighting needs to be appropriately increased so that the individual can read medication labels. There should be no extension cords. And remember, evaluation is an ongoing process for the nurse. A nurse floats to a busy surgical unit and administers a wrong medication to a patient. This error can be classified as a poisoning accident, an equipment-related accident, a procedure-related accident, an accident related to time management. The answer is C. When an error occurs due to the actions of a health provider, it is considered a procedure-related accident. What information should be included in the nursing documentation notes?